Welcome to today's video about symptoms of iron deficiency. What if the reason you're tired all the time isn't just stress or a busy schedule? What if your body is desperately trying to tell you something and you've been missing the signs? Here's a shocking fact. Iron deficiency affects over 1.6 billion people worldwide. That's nearly 1 in 5 humans silently struggling with low energy, brain fog, brittle nails, and even unusual cravings. And many have no idea why. The most surprising part? Some of the earliest symptoms are easy to spot, but often completely ignored. Why aren't we talking about this more? Why does something so widespread get brushed off as just being tired? Maybe because the consequences of missing it are huge, and fixing it is often surprisingly simple. In today's video, we're revealing the top symptoms of iron deficiency. Some you've definitely heard of, and others that will absolutely surprise you. Backed by real science, expert research, and patient stories, this is information you need to know. And here's the twist. One of the most overlooked symptoms could be hiding in plain sight, literally on your face. Stick with us to the end because the last symptom we cover might just change how you see your health forever. Ready to uncover the truth? Let's dive in. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified, references are linked in the description. Now let's break down the most common symptoms, starting with the very first one. Extreme fatigue. Ever felt drained even after a full night's sleep? That kind of deep, lingering fatigue might be more than just stress. It could be your body signaling low iron levels. Iron plays a crucial role in producing hemoglobin, the protein in red blood cells that transports oxygen throughout your body. When iron is scarce, your cells receive less oxygen, leading to that persistent tiredness. This isn't just about feeling a bit sleepy, it's about a lack of energy that affects your daily life. Recent research highlights this concern. A 2023 study published in the journal Blood found that individuals with iron deficiency, even without anemia, experienced significant fatigue. The study emphasized that correcting iron levels improved energy, underscoring the impact of iron on vitality. It's easy to dismiss such fatigue as just part of a busy life. However, if you're constantly exhausted without a clear reason, it's worth considering your iron levels. A simple blood test can provide clarity. Addressing iron deficiency isn't just about feeling better. It's about restoring your body's ability to function optimally. Don't let fatigue be your norm. Listen to what your body might be telling you. Next, number 2. Pale skin. Imagine looking in the mirror one morning and noticing your skin seems unusually pale. This change might be more than just a cosmetic concern. It could be an early sign of iron deficiency. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen throughout your body. When iron levels drop, your body produces fewer healthy red blood cells, leading to less oxygen reaching your tissues. This lack of oxygen can cause your skin to lose its healthy color, making it appear paler than usual. A 2024 review published in Current Pediatric Reviews highlighted that pallor is often the most frequent presenting feature of iron deficiency anemia, especially in children. The study emphasized that even mild to moderate iron deficiency can lead to noticeable changes in skin tone. It's important to pay attention to such subtle changes in your appearance. If you notice persistent paleness, especially in areas like your face, inner eyelids, or nails, it might be time to consult a healthcare professional. Early detection and treatment of iron deficiency can prevent more serious health issues down the line. Next, number 3. Shortness of breath. Feeling winded after climbing a flight of stairs or during a routine walk might seem like a sign of being out of shape. However, if this breathlessness is new or worsening, it could be an early indicator of iron deficiency. Iron is essential for producing hemoglobin, the protein in red blood cells responsible for transporting oxygen throughout the body. When iron levels are low, the body produces fewer and smaller red blood cells, leading to reduced oxygen delivery to tissues. This oxygen deficit can cause the sensation of shortness of breath, especially during physical activity. A recent study published in the Journal of Hypertension, 2024, found that 81.7% of patients with iron deficiency reported breathlessness as a primary symptom. This highlights how common and significant this symptom can be in the context of iron deficiency. If you're experiencing unexplained shortness of breath, it's important to consider iron deficiency as a potential cause. Consulting with a healthcare professional can lead to appropriate testing and treatment, helping you breathe easier and improve your overall well-being. Next, number 4. Headaches or dizziness. Ever felt lightheaded or experienced a pounding headache that just wouldn't go away? These could be more than just everyday nuisances. They might be early signs of iron deficiency. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen throughout your body. When iron levels drop, your body struggles to transport oxygen efficiently. This lack of oxygen can cause your brain to receive less than it needs, leading to symptoms like dizziness and headaches. A 2019 study published in the International Journal of Hematology Oncology and Stem Cell Research found a significant association between iron deficiency anemia and chronic daily headaches. The research indicated that individuals with severe iron deficiency experienced more frequent and intense headaches compared to those with normal iron levels. If you're noticing these symptoms, it's worth discussing with a healthcare provider. They can perform simple blood tests to check your iron levels and recommend dietary changes or supplements if necessary. Addressing iron deficiency early can help alleviate these symptoms and improve your overall well-being. Next, number 5. Brittle nails. Your nails can reveal a lot about your health. If you've noticed them becoming thin, fragile, or breaking easily, it might be more than just wear and tear. Iron plays a crucial role in producing hemoglobin, the protein in red blood cells that carries oxygen. When iron levels drop, oxygen delivery to various parts of the body, including the nail matrix, diminishes. This reduced oxygen can impair nail growth and strength, leading to brittleness. A recent study published in Scientific Reports 2023 highlighted that iron deficiency anemia is associated with brittle nails, especially in women aged 50 to 59. The research emphasized that nail brittleness could serve as an early indicator of iron deficiency, even before more overt symptoms manifest. If you're experiencing persistent nail brittleness, it's essential to consider your iron intake. Incorporating iron-rich foods like lean meats, legumes, and leafy greens into your diet can help. However, if dietary changes don't improve your nail health, it's advisable to consult a healthcare professional for further evaluation. Next, number 6. Hair loss. You might notice more strands in your brush or on your pillow. It's not just about aging or stress. Low iron levels could be playing a role. Iron is crucial for producing hemoglobin, the protein in red blood cells that carries oxygen. When iron is scarce, your body prioritizes vital functions, and hair growth takes a back seat. This can lead to increased hair shedding, often before other symptoms of iron deficiency become apparent. A 2023 study published in the Tzu Medical Journal examined 155 women experiencing hair loss. The researchers found that 70.3% had iron deficiency, defined by serum ferritin levels below 60 nanograms per milliliter. Notably, those who began iron supplementation within 6 months of hair loss onset showed significant improvement in hair regrowth. This suggests that early intervention can be key to reversing hair loss linked to iron deficiency. If you're noticing unusual hair thinning, it might be time to check your iron levels. Addressing a deficiency early could help restore your hair's health and vitality. Next, number 7. Restless leg syndrome. Ever felt an irresistible urge to move your legs, especially when you're trying to relax or sleep? That twitchy, uncomfortable sensation might be more than just restlessness. It could be an early sign of iron deficiency. Iron plays a crucial role in producing dopamine, a brain chemical that helps regulate movement. When iron levels drop, dopamine production can falter, leading to those unsettling leg sensations. This isn't just a theory. Brain imaging studies have shown reduced iron concentrations in areas like the substantia nigra among individuals experiencing these symptoms. A recent study from 2023 highlighted this connection by examining textile workers in Iran. The research found that lower levels of ferritin, an iron storage protein, were significantly associated with increased severity of these leg sensations. In fact, women in the study had a 69.5% prevalence of iron deficiency anemia, correlating with higher reports of discomfort. Addressing iron deficiency isn't just about alleviating leg discomfort, it can also improve sleep quality and overall well-being. If you find yourself constantly battling the urge to move your legs at night, it might be time to check your iron levels. Next, number 8. Frequent infections. You might not realize it, but if you're catching colds or other infections more often than usual, your body could be signaling an underlying issue: iron deficiency. Iron is crucial for your immune system. Without enough of it, your body struggles to produce the white blood cells that combat pathogens. A 2023 study published in Wellcome Open Research highlighted that severe anemia, often stemming from iron deficiency, increases the risk of invasive bacterial infections in young children. The study delved into how iron dysregulation impairs immune responses, making it harder for the body to fend off infections. Moreover, research from the University of Florida, published in Nature Immunology in 2023, discovered that iron regulates specific immune cells in the gut. These cells are vital for maintaining a robust immune response. When iron levels are low, these cells don't function optimally, leading to a weakened defense against infections. So, if you're frequently under the weather, it might be more than just bad luck. Your body could be hinting at an iron deficiency, affecting your immune system's ability to protect you. Next, number 9. Poor concentration. Struggling to stay focused during work or study sessions? It might not just be stress or lack of sleep. Emerging research suggests that even mild iron deficiency can subtly impair cognitive functions, particularly concentration. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. When iron levels are low, less oxygen reaches the brain, which can affect mental alertness and focus. This isn't just about feeling tired, it's about the brain not getting the oxygen it needs to function optimally. A 2023 study published in PLOS One analyzed data from multiple trials and found that iron supplementation significantly improved attention and concentration in school-aged children, especially those who were anemic. The study reported a standardized mean difference of 0.44, indicating a moderate improvement in cognitive performance with iron supplementation. These findings highlight the importance of maintaining adequate iron levels for cognitive health. If you're experiencing persistent difficulties with concentration, it might be worth discussing with a healthcare provider who can assess your iron status and recommend appropriate interventions. Next, number 10, swollen or sore tongue. A sore or swollen tongue might seem like a minor issue, but it can be an early sign of iron deficiency. Iron is essential for producing hemoglobin, which carries oxygen in the blood. When iron levels drop, oxygen delivery to tissues decreases, leading to various symptoms, including changes in the tongue. One noticeable change is atrophic glossitis, where the tongue appears smooth, shiny, and red due to the loss of papillae. This condition can cause discomfort, burning sensations, and increased sensitivity, especially when consuming spicy or acidic foods. A study published in the American Journal of the Medical Sciences found that patients with iron deficiency experienced glossal pain, which improved with iron supplementation. These tongue changes can occur even before other symptoms of iron deficiency anemia become apparent. Therefore, paying attention to oral health and seeking medical advice when noticing such changes can lead to early diagnosis and treatment. Addressing iron deficiency early can prevent more severe complications and improve overall well-being. Next, number 11. Cravings for non-food items. A sudden urge to chew on ice or nibble on chalk might seem odd, but it's more common than you'd think, and it could be your body's way of signaling an iron deficiency. This behavior, known as pica, involves consuming non-food items like ice, clay, or paper. It's not just a quirky habit, it's often linked to low iron levels in the body. In fact, a 2023 study published in Curious found that individuals with iron deficiency anemia were 2.35 times more likely to exhibit pica behaviors compared to those without the deficiency. One of the most prevalent forms of pica is pagophagia, the compulsive consumption of ice. Researchers believe that chewing ice might temporarily boost alertness in iron-deficient individuals by increasing blood flow to the brain. However, this is merely a short-term fix and doesn't address the underlying issue. The good news? Addressing the iron deficiency often leads to a rapid decline in these unusual cravings. In the same Cravings study, patients reported a significant reduction in pica behaviors within days of starting iron supplementation. So, if you find yourself constantly reaching for non-food items, it might be time to consult a healthcare professional. A simple blood test can determine your iron levels, and appropriate treatment can help eliminate these cravings. Next, number 12. Cracked corners of the mouth. Noticing painful cracks at the corners of your mouth. This could be more than just dry skin. It might be an early sign of iron deficiency anemia. Iron is essential for maintaining healthy skin and mucous membranes, including the delicate tissue around your mouth. When your body lacks sufficient iron, it struggles to repair and regenerate these tissues, leading to conditions like angular cheilitis. A 2023 study published in the Cleveland Clinic Journal of Medicine highlighted a case where angular cheilitis was the primary clinical manifestation of iron deficiency anemia. The patient exhibited persistent cracks at the mouth corners, which improved significantly after iron supplementation, underscoring the link between iron levels and oral health. If you're experiencing similar symptoms, it's important to consider your iron intake. Incorporating iron-rich foods like leafy greens, legumes, and lean meats into your diet can help. However, if the condition persists, it's advisable to consult a healthcare professional for appropriate testing and guidance. Next, number 13. Irregular menstrual cycles. Many women experience changes in their menstrual cycle, but when periods become irregular, it might be more than just a hormonal hiccup. It could be an early sign of iron deficiency. Iron plays a crucial role in producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. When iron levels drop, the body struggles to produce enough healthy red blood cells, leading to iron deficiency anemia. This condition doesn't just cause fatigue or weakness. It can also disrupt the delicate balance of reproductive hormones, leading to irregular menstrual cycles. A recent study published in the American Journal of Obstetrics and Gynecology, 2023, highlighted that heavy menstrual bleeding is a significant contributor to iron deficiency and its most severe manifestation, iron deficiency anemia. The study emphasized that both heavy menstrual bleeding and iron deficiency adversely impact the quality of life for reproductive-aged women, often leading to a cycle of worsening symptoms. Moreover, research involving Malaysian university students found that those with anemia had significantly longer menstrual cycles and more days with heavy flow compared to their non-anemic counterparts. This suggests a direct link between iron deficiency and menstrual irregularities. If you've noticed changes in your menstrual pattern, be it timing, flow, or frequency, it might be worth considering your iron levels. Addressing iron deficiency early can help restore hormonal balance and regularity to your cycle. Next, number 14. Tingling or crawling sensation. In limbs, experiencing a persistent tingling or crawling sensation in your arms or legs, especially when you're resting, might not just be a passing discomfort. This could be an early sign of iron deficiency. Iron plays a crucial role in nerve function. When iron levels are low, it can disrupt the way nerves communicate, leading to sensations like tingling or numbness. This condition, known as peripheral neuropathy, affects the nerves outside the brain and spinal cord. A study published in the International Journal of Neuroscience in 2023 found that individuals with severe iron deficiency anemia exhibited neurological symptoms, including tingling in the hands and feet. Moreover, iron deficiency is linked to restless legs syndrome, RLS, a condition characterized by uncomfortable sensations in the legs and an uncontrollable urge to move them. These sensations often worsen during periods of inactivity and can interfere with sleep. The National Institute of Neurological Disorders and Stroke notes that iron deficiency can cause or exacerbate RLS symptoms. If you're noticing these sensations regularly, especially at rest or during the night, it's important to consult a healthcare professional. They can perform a simple blood test to check your iron levels and recommend appropriate treatments or dietary adjustments. Next, number 15. Slow wound healing. When your body lacks iron, it struggles to deliver enough oxygen to tissues. This shortage can slow down the healing process. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen. Without sufficient iron, less oxygen reaches the wound site, hindering the energy supply needed for tissue repair. Moreover, iron plays a role in collagen synthesis, a protein that provides structure to the skin. Insufficient iron can impair collagen production, leading to weaker tissue regeneration. A 2023 study published in the McGill Science Undergraduate Research Journal highlighted that maintaining optimal iron levels is crucial for effective wound healing. The research emphasized that both iron deficiency and excess can disrupt the healing process, underscoring the importance of balanced iron levels in skin repair. If you notice that minor cuts or scrapes are taking longer than usual to heal, it might be worth discussing iron levels with a healthcare professional. Next, number 16. Blue tinge to whites of eyes. Ever noticed a subtle bluish hue in the whites of someone's eyes? This isn't just a quirky trait, it can be an early sign of iron deficiency. In a documented case, a 46-year-old woman experienced fatigue and shortness of breath over 3 months. Upon examination, doctors observed a bluish tint in her sclera, the white part of the eyes. Lab tests confirmed severe iron deficiency anemia. After 3 months of iron supplementation, not only did her symptoms improve, but the blue hue in her eyes also disappeared. What's the science behind this? Iron is crucial for collagen production, which maintains the thickness and strength of the sclera. When iron levels drop, collagen synthesis is impaired, leading to a thinner sclera. This thinning allows the underlying UVEA, which has a bluish color, to show through, giving the sclera a blue appearance. Research indicates that this blue tint has an 87% to 89% sensitivity and a 64% to 94% specificity for diagnosing iron deficiency anemia. This means it's a relatively reliable physical sign that shouldn't be overlooked. So, if you or someone you know notices this bluish hue, it's worth consulting a healthcare professional. Early detection of iron deficiency can lead to timely treatment and prevent more severe complications. That's it for today's video on the often overlooked symptoms of iron deficiency. If any of this hit close to home, we'd love to hear your story. Have you experienced any of these symptoms? How did you manage it? Drop your thoughts in the comments below. And if this video helped you better understand your health, just type "helpful" in the comment box. It really encourages us to keep creating content that empowers you to take control of your well-being. Don't forget to give this video a like, subscribe if you haven't already, and hit the bell so you never miss our next health insight. Thanks for watching, and take care of yourself. Your body is always sending signals. You just need to know how to listen. See you in the next one.